Faster, fresher, sparkling, informative, protective, with a minty aftertaste. This is Quick Zips, the late night edition. Sexuality education, fast.
I'm Galena Mines, and welcome to our show. You ask, we answer. Today's question comes from Bob, a viewer in North Dakota. Bob thinks he might have a sexually transmitted infection and would like to know what he should do. So today's question is, what should I do if I think I have an STI? Here's the deal, Bob, and anyone else who thinks they might have an STI. Stop engaging in any type of sexual activity because you could easily infect someone else. And visit a healthcare provider immediately so you can be tested. Getting tested is the only way you can know for sure, and the way to get treatment. Now, these are two very easy things to do. That is, the actions are simple. It's no big deal to stop sexual activity, and it's no big deal to go to a doctor. However, the anxiety these actions might cause can be a big deal and are quite common. Many people feel anxious when going to get tested, but they are glad they did it afterwards. Stopping sexual activity means you have to tell your partner you are stopping, and he or she is going to want to know why. It is best to be honest and open with your partner about your concerns. This can be hard, since you may feel embarrassment, shame, or even anger. Use your communication skills to clearly and confidently state the situation. You might even go to a healthcare provider together in order to get to the bottom of your concerns. Speaking of healthcare providers, some people may also be embarrassed to tell a doctor they think they might have an STI. This is stigma and can keep you from getting the help you need. Get over it. When you go to the doctor, your doc will likely do a few simple things. The doc will ask questions and run some tests. The two most common tests are a urine test and a body fluid swab. Both are relatively painless. Some doctors will want to do a blood test as well to check for other types of STIs, like HIV. The doc will tell you the results, treat you if you have something, and provide counseling and information about prevention. In most cases, doctors have to keep everything you tell them private. In fact, in all states, docs are allowed to test you for an STI without your parents' permission. It is best to be honest with your doctor. This means being honest about whether or not you've had sex and what types of sex you've had. If he or she has to guess what is going on, then you might not be diagnosed correctly. This would be bad and a total waste of time. That's it for this segment of Quick Zips, the late night edition. Remember, if you think you have an STI, stop and see a doc. Be safe. See you next time.
This episode of Quick Zips is brought to you by Doctors Dover and Koff, who would like to remind you that being worried that you might have an STI can be worse than the actual STI.